I'm a clinician and a natural scientist, so I always try to be very pragmatic, because without pragmatism I would not survive my 80-hour week. So I enjoyed a lot of the discussions that we had today, and all of the issues that have been risen are very important ethical, legal points, communication points that we see in our everyday life and that are very important to consider in our scientific life. However, I would like to focus our attention a little bit more on LifeTime and what the tasks in LifeTime could be, because we will not be able to solve all the problems of the world in LifeTime. And for some parts, we don't have to reinvent the wheel, because some parts are regulated very well by the European Commission on the national level. So we have laws that have regulations that have been developed already on all these issues and that are in place. And as clinicians, we have to adhere to them, and also as scientists, we have to adhere to them. So this is not, I think, this is my personal opinion, not the field where we should engage in LifeTime. If something is there, we just have to make sure how to adhere to it and that the scientists are aware of it. So this is a question of education and maybe also of developing some kind of guidebook for scientific dummies with the regulations that have to be adhered in the context of the research that is done here, so that there is some knowledge about it, and also some very pragmatic checklists. What do I have to, if I want to have a research project? What do I have to keep in mind on the ethical side, on the regulatory side? So this is what I think should be developed, and we have to focus on 4 different fields from my point of view. The first field is data security, data protection, with AI now coming into a new dimension. And a lot of this has been regulated already. We have a good EU data regulation background, and we are all aware of it. So in LifeTime it will be important to apply it. For AI, maybe not all the issues are solved yet, so there will be other developments, but I don't think this will be the task of LifeTime. This will be the task of other groups. We just have to be aware what is developing there. The next part is biomaterial, and we did not discuss a lot about biomaterial yet. And this is something very essential for LifeTime, because if we use biomaterial for the different research questions, we have to ensure that an appropriate informed consent for this biomaterial is there. And this could be within a clinical trial, this could be project-specific, prospectively, but an informed consent for every kind of sample that we are analyzing in LifeTime has to be there, and we have to have a pathway to ensure that this is checked somehow. And when we know what kind of research is planned in a project, we have to check every kind of informed consent if this type of research is covered by the informed consent that is there. Because we will have retrospective patient cohorts with an informed consent that has been obtained, and it covers either broadly everything or very specifically something, and this has to be adapted to the research we want to do. If it's not covered, we can either not use the biomaterial, or we have to prospectively get a new informed consent, which for us as physicians is a pain in the neck, because if you have treated 100 patients, they have left your hospital, some of them are lost of follow-up, and to find them one by one, to send them a new informed consent is really not feasible. So I would suggest to better restrict on samples where the informed consent covers whatever you want to do. And in such an informed consent, we have to be careful to cover what kind of research is planned with the biomaterial. So if this is tissue, if this is genetic data, if this is germline data, because all of this has different implications. Also, if we want to generate organoids or patient-derived xenografts, all of this has to be listed in an informed consent. If it's not there, you are not allowed to do it. I would also suggest to get an expert from the biobanking field into a small work group, maybe defining these paths, because there are also established biobanking rules that are there, and you don't need to reinvent the wheel here too. The third field that I came across this morning, and I think really maybe here LifeTime could develop something new, is the field of communication, and together with the communication work package, I'm not aware of any very specified guidelines at which time point in research to communicate which content to which group. So this really is lacking, and we have different different groups to communicate to. First of all, it's the patient, and there we have to be most careful to not awake false hopes. So to help them interpret the data at the level of evidence that is there, and not to claim something that has not been thoroughly validated within clinical trials as usual. We experienced this a couple of years ago when a researcher in Germany went to the lay press with cell culture data, and then we spent hours and hours to explain to the patients that what works in a cell culture is very different from what later works as a drug in a patient, and some don't understand it and then just use this stuff, even against medical advice. So this is a very, very essential issue, how to communicate to patients at what stage of the results, and what kind of validation process has to be planned for the different research that can communicate it really in the lay press. It's different if we communicate among scientists, because they can better judge the level of evidence, and there we need to be less cautious, but still it has to be evidence-based. We have to communicate with industry, and there are different foci of information, like market value, have to be taken into consideration. We also have politicians, and here we may not be so restrictive, because if we don't explain them the potential that is there, even if we are a little bit further from this potential, they will not invest, because they have to explain to their voters they are investing in a very important topic, and this is what we have to explain to them. So in the different groups we have to have different communication strategies, and have to be careful that these are the appropriate ones. So I would like to have, we always talk about precision medicine. Maybe we should add a level of precision information and define what we mean by that, and what we would like to deliver to the different groups in which time frame, so that we can make sure that this is the case. So we have two different things. We have to implement what is already there. We have to identify the gaps, and what we have definitely also to identify in LifeTime is data access between scientists, because this is a topic that has to be defined in each specific research project, who is allowed to see the data, and this also relates back to the informed consent. It is a difference if I consent to a research project, or if I consent for economical industry use of my biomaterial and data, or if I consent to broad use by Facebook and Google. And this I have to be asked in my informed consent as a patient, and if I want to use it accordingly, this needs to be written down somewhere. If it's not, I need to obtain it. And in this level we should assess what is needed for LifeTime, where are regulations in place, and then we can just check it and it's done, and where maybe we come into fields where regulations are not yet developed, and then we have to do the work.